So what we have here, well, male reproductive system, but what are the accessory glands? And they are, you have to identify them in the homework a bit. But yeah, here we have the seminal gland, or some, I like the term seminal vesicle. It kind of rolls off the tongue. And it kind of, well, it's more of a slant rhyme. But again, I like that term. So you may have heard both terms. And then you have the prostate gland, that's pretty consistent. And then you have the bulbourethral gland, or sometimes called Cowper's gland. And these together are your accessory glands. So these help to make the additional fluids and components of semen. So again, sperm refers to the cells, but semen is a mixture of the sperm and the fluids that these glands secrete. Now what we have over here is the prostate gland. So let's talk about the prostate gland a little more. So let's more specifically, let's talk about prostate cancer. So yeah, you may, okay, it's cancer and it occurs in the prostate. But what about it? Well, the interesting thing is that the biggest risk factor for prostate cancer is age. And who's most at risk of prostate cancer? Well, men who, that median age, so say you had all the men who were newly diagnosed or have been diagnosed with prostate cancer in the United States, line them up and by age and choose the guy in the middle. That's the median age, and the median guy would be 67 years old. So it does disproportionately affect older men. And it's very rare in men less than 40 years old. So again, most of you in this class who are male, you probably don't have to worry about this for a while. So 92% of cases are diagnosed in men who are, well, not quite retirement age, but they're definitely past middle age. So 55 plus years old, that's the majority of men who develop prostate cancer. Now, what about prostate cancer? So how does it develop, or what are features of prostate cancer? Well, there's an enzyme called 5-alpha reductase, and what we see in prostate cancer is an increase in this enzyme. So what does this enzyme do? Well, what this enzyme does is convert testosterone, which is an androgen, into dihydrotestosterone, or DHT. Now, what's the difference besides a little shuffling around of chemical groups? Well, the interesting thing is that DHT is actually more powerful in terms of causing androgenic activity. So they both bind to a receptor called the androgen receptor. Testosterone is a pretty powerful activator and what we call an agonist of that receptor, but DHT is even more powerful. So what it's basically doing is kind of like super saiyaning testosterone. It's making it more powerful. So DHT is more powerful. And the interesting thing is that you also see increased aromatase in prostate cancer. So remember aromatase, what does that do? Well, the starting reactants and the substrate are androgens, and then the product is going to be, so again, androstenedione. Hey, that sounds like the one we heard we were talking about with the granulosa cells, right? And then or made by the theca cells and then converted into estrone by the granulosa cells. And testosterone can be converted into estradiol as well. So what we see is that prostate cancer increases these enzymes that basically affect steroid synthesis. And it also increases, now this isn't a steroid, and this is a peptide, and again, it's a peptide, and this is why we're representing it by this ribbon structure. So it is a protein, and this particular protein that we see in elevated levels in a man who has prostate cancer is called prostate-specific antigen, or PSA. So you typically see increased levels of the receptors, of these activities, and all of these enzymes in prostate cancer. So you're starting to see these prostate cancer cells crank out these hormones. And the interesting thing is that these hormones also trigger prostate cancer cells to grow. So in general, androgen receptors trigger cell growth, and not in all cells, but in this case it does. And even estrogen receptors, they tend to promote growth, especially estrogen receptor alpha.